The case study of the service pledge that's been promoted by Breakthrough Breast Cancer, which is a charity, we liked because it's about senior managers having the courage to listen to someone from outside about how services could be improved. And it is a model of how a patient advocacy group can actually help a hospital and a service become a truly patient-led and patient-focused service.
46,000 women in the UK who are newly diagnosed with breast cancer each year, and it's estimated there are about 500,000 women living with breast cancer in the UK.
The breast care services in Boston were worked out of a porta cabin which was very old, didn't have a lot of facilities. Our patients would have to walk down the corridor to have their mammogram, and sometimes they'd be quite distressed. So they'd be crying, walking down the corridor. Once they'd had their bad news results that perhaps they'd got breast cancer, they then would have to walk through the waiting room with all the people waiting to be seen to go and have blood tests taken.
When I was first diagnosed, it was like a cattle shed in a way, just in a little room, and you were just given your news and that was it really. But now this is absolutely amazing from the moment you walk in the door.
The new unit, it's just brought on a whole new way of working for us with all the disciplines being in one place. They're greeted by a friendly receptionist, then taken by the mammographers to have their mammograms done, and then they're introduced to the breast care nurses when they come for their clinical examination.
When we talked about the new unit, we talked about trying to take new attitudes, not to take some of the old stuff with us, but to try and look at new ways of working, new attitudes. That meant that we had to think about how we could restructure the clinics differently. One of our colleagues, she'd been at the Breakthrough meeting where the service pledge had been discussed, and she thought this would be a good way forward for all of our units.
Well, the service pledge came about by us initially consulting women about their priorities for services and treatments, and also their experience of treatment. We were getting very consistent messages about real problems that people experienced when they went for treatment for breast cancer. So we decided to develop a tool to enable healthcare professionals and patients to work in partnership to identify what would really make a difference, what the real priorities were in achieving a really good high quality of service.
I worked very closely with the project manager from Breakthrough, and she came and explained how the Breakthrough Pledge would work for us. First thing that happened was that we actually took a walk, some of my colleagues and myself, through our unit to look as if we were the patients, so we could see the journey through our own eyes as the patients would see.
The patient comes in and goes for the mammogram. They will talk to you and explain to you what's going to happen, so you don't feel you're left in the dark. They tell you everything, every step of the way. The results are done and sent back with that patient straight away, so there's no waiting 2 or 3 weeks to know whether you've got breast cancer or not. You're told there and then.
Having a diagnosis of cancer, having a diagnosis of something like breast cancer affects all aspects of people's life. It affects their health, it affects their sense of well-being, their family, often employment, often financial matters. And all of this can cause a great deal of anxiety and distress and uncertainty.
I think it's important that we recognise that patients can have their operation and be physically well, but psychologically they're still quite traumatised by the disease process and the fact that you've got a life-changing event happening. So I'm able now to provide this counselling, and it was really the Breakthrough Service Pledge that helped to get that off the ground and really establish it as a meaningful way of working with people.
Somebody will sit with you, talk you through everything, tell you what's going to happen next, which really is 100% better than what it was.
The breast unit that we've got here now, everybody has worked long and hard for it. It's what they deserve.
I hadn't quite dreamt that it would be this good, and I think it's a wonderful place to work.
The feedback that we now get from the patients is very good. Excellent.
Managers in Partnership supports innovation and partnership working in healthcare. Where something works well, we want to tell people about it so the public everywhere can benefit.